Hello, my name is Alexandra and I will be doing my insertion of Foley catheter video. I have verified my physician's order, identified my client, checked for any allergies. I have also washed my hands, donned my clean gloves, and now I'll go ahead and assist them in the proper position. If they're female, it will be dorsal recumbent, and if they're male, it'll be supine or semifilars. Next, I go ahead and perform my perineal care, and then undone my gloves and wash my hands. Okay. Next, I will go ahead and open up my Foley kit, taking out the label, throw it away, and then we'll set that down carefully. Then I'll go ahead and make a garbage bag with the plastic, set that there. Okay, next I'm going to go ahead and open up my sterile drapes here. So we're going to open up this side furthest away from us first. Then we want to open up our sides, and then the last fold towards me will be the next one. Okay, next I'll go ahead and pinch out my sterile gloves. And we're going to don our sterile gloves here. I'm going to put on my dominant glove first, which would be my right hand. Okay, next I'm going to put on my non-dominant glove, making sure I only touch the inside cuff this time. I can touch the outside. Sterile. Got those on. I use my elbow to try to slide this off into the trash, like so. Okay. Next, I go ahead and pinch out my absorbent pad. We want to put the shiny side down. But first, since this is sterile, we're going to scoot that over here, like that. I do have a 1-inch border. So now that I have the shiny side down, I will rotate this under my hand or fingers so I do not touch any skin, and we want to slide this under our client like so, and I can readjust this and put that back down. Then I can go ahead and take out my other drape. We're going to put this over the perineal area like so, and carefully slide that over here. Alrighty. Next, I will go ahead and open up all of my contents carefully inside of my kit. And this will include the cap of my sterile container of my syringe. And I'm going to go ahead and connect this into the injection port. Alrighty. Oh, carefully. I'm going to make sure it's still in our 1-inch border. Okay. Next, I'll go ahead and open up my alcohol swab sticks, and I will place this over my gauze or my cotton balls. Open up my lube, put my lube down. I will also open up my specimen container if a specimen is needed, and I will carefully go ahead and take this off of my catheter. Alrighty. Next, I will go ahead and also lubricate my catheter, approximately 1 to 2 inches for women and 5 to 7 inches for men. Then, next, I will go ahead and get my antiseptic swabs. For women, I want to separate the labia, and I want to start from meatus downward. Throw that away. Then I'm going to get to the labia that's closest to me, from meatus downward, throw that away. Then I want to go directly in the middle. Next, for men, I would lift the penis, retract the foreskin if indicated, and I will clean in a circular motion from meatus down to the glands. And I would do this one stroke downward, throw it away, and I'll do this 3 times, 3 separate swab sticks. Okay, now that I have everything clean, I will go ahead and insert my catheter. So with my left hand, since I do have a female, I will separate the labia like so. And then I will go ahead with my sterile dominant hand. We're going to go ahead and insert the catheter. For females, I want to insert 2 to 3 inches. I do not want to force the catheter inside the urethral bladder. Instead, I want to do a twist motion, and I'll ask my client to take a deep breath. Once I meet resistance, outside of the external sphincter, I will keep advancing until urine drains. And for females, I will advance until 1 to 2 inches, after urine drains. Okay, now that I got that advance, alrighty. I would also, for males, I would advance it to the bifurcation right here. Okay, so that's inserted. So now I will take my dirty hand and I would hold the catheter. And then I would take my clean dominant hand, sterile, and I will push all of this sterile saline inside of my sterile water inside of my balloon until that's inflated fully. Okay, once I know that that is inflated fully, I will gently tug back and forth for resistance. Next, I will go ahead and connect my catheter to the Velcro strap, with a Velcro strap, or with tape to the upper thigh area. I'm so sorry, upper thigh for females, and upper thigh or lower abdomen for males. Once that's secured, I will go ahead and secure my catheter to the bed frame. Then I will go ahead and wash my hands, undo my gloves, wash my hands, and then I will record. I will record my observations, including my appearance and amount of urine collected. I will record the time of catheterization, the type and size of catheter used, my patient's tolerance, and the procedure. And that'll be complete.